Hey everybody, today we are talking about limbers, and the important thing to keep in mind with a limber is it's essentially just a body wave and a weight transfer all in one. The limber is one of the most important movements to learn in gymnastics because it translates to front and back tumbling, as well as bars with the tap swing, the giants, as well as beam with all of the handspring step out, layout step out work that you'll be doing, front aerial work, and as well as vault with all the Yurchenko and the front handspring front. So essentially the front limber is a base element that is necessary to improve in all aspects of gymnastics, and that is really what makes the limber important to understand and perform accurately. So the prerequisite for a limber is a bridge, and you're going to see that the number one image has an arrow pointing kind of up into the upper back at a diagonal, and that is because it is saying the bend needs to happen in the thoracic spine and through the shoulders. The number two arrow is showing you that the bend is more evenly. It's kind of happening in the middle of the back. And this is okay too because this is a transitional shape and usually a pretty decent starting point for anyone who's trying to develop their bridge. The number three is showing you that the bend is happening in the lower back or the hips, and that's really not where you want it to be happening. You don't want to be loading the lower back or the lumbar of the spine because in gymnastics we tend to overwork the lower back. That's where a lot of the injury comes from. So understanding what the number one bridge looks like and the number two bridge looks like is basically going to be the benefit of developing a front or back limber appropriately. Now, the bridge itself actually takes time to develop. So either a student is going to come already having a bridge, like the number one bridge, or they're going to have to develop it over time. And that's where you have to monitor the amount of numbers they're doing with their limbers, how successful they are, and really help them be encouraged through the process, because developing a bridge actually takes a while. And so it's not something that, say, a student that comes in 1 hour a week is going to see a massive amount of improvement on. So here we have the front limber, and the first image is starting in a handstand, and the reason that is because you can get into the handstand however you want to. Generally, when we use the word front limber, we mean that your feet stay together the entire time, so they would jump up or pike up or press up, but they could lever into a handstand. They could get into that handstand however you wanted them to. So the third image with the arrow pointing to the left is letting you know that the shoulders need to stay open as the feet fall into the floor. So the shoulders are open over the hands as the feet are coming down. The orange star is letting you know that this is the place where the weight transfer is beginning. And as the feet touch, you're trying to transfer the weight all the way over through the bridge shape into where the blue star is. Now you're going to see below there's kind of two error signs. The one on the left shows the wrong or the improper bridge technique. The one on the right shows that the red arrow is pointing vertically, and so how you stand up is going to determine how you load the lower back. And so when you stand up trying to bend in the lower back, it tends to stand up more vertically than if you displace the bend evenly through the body, which you see is the image above with the orange arrow pushing horizontally to the right. If you notice the transition from the orange star to the blue star, the bridge doesn't really rise a lot. It's actually just a weight transfer from one side of the body to the other without a lot of up and down movement. And you kind of want to gradually get the rise to happen. So if you look at the orange arrow pushing to the right with the hips open, and then you see the body transition to stand, it has a gradual rise. And so that's very important that you don't just try to stand up right away. The other thing that you're looking at is the shoulder angle needs to be open, and the head position needs to be eyes looking at your hands. These are the two most common errors: is the shoulders will close and the head will drop, and usually they will not be successful in standing up. There needs to be a smooth transition of weight over the feet essentially as the body's coming to a stand, and so that's pretty noticeable to see how coordinated the stand actually looks. So the back limber is just the reciprocal. You're starting in a handstand, you're arching backwards, and as you do this, you're pushing the feet over or the hips over the feet. Notice here you have in the third image on the left, you have the shoulders over the hands, and in this one, in the fourth image, really you have the hips over the feet. So to get the hands down, the hips are traveling over the feet. Then as you get your hands lower to the ground, the body starts bending as evenly as possible through the knees, hips, and back. The orange star is letting you know that right before the hands touch, there is this weight transfer that's going to happen. So as the hands are touching, you're transferring the weight over to the blue star. The error image is just representing the do not bend in your lumbar, your lower back, and have this fold in half thing that all the pressure is happening in your lower back. Try to get the bend to be as evenly as possible. This might mean you have to push the knees forwards over the feet a little bit more to get more of an even bend. So after the blue star, the figure is standing up or pulling their feet over their shoulders. You're going to notice there's an orange arrow pushing to the right. This means keep your armpits open over your hands and have it pull your feet up to the ceiling. Oftentimes this is where the shoulder angle will close and the body will collapse on itself. So there you have it, front limber, back limber. Easier said than done. You're going to have to see a lot of them. You're going to have to be very particular on what thing you want achieved, because there's a lot of moving parts. And usually when a person's first learning this, they become overwhelmed. They're just scared to, try to stand up, or they're scared to back bend into their back limber. And so there's a lot of little things nuances that you have to really overcome. And so with the limbers, don't just assume that because a person can limber and transfer weight from their feet to their hands and their hands to their feet, that they're ready to progress or move on. There's really a level of proficiency that needs to happen when learning a limber, because it translates into so much more of their gymnastics. So there you have it, limbers, weight transfers. As always, ask questions. And until next time.